Hello. Hello, hello. Welcome, everybody.
Hey.
We are currently waiting on our guest speaker today. He is just running a few minutes late, but he should be on any moment now. So while we wait for him, I'm just going to introduce everybody to the platform, get everybody situated. So today we're going to be talking a little bit about how to stay compliant with the vaccine mandate in healthcare. I am joined currently by our business consultant here at workforce.com, Bo. Bo, welcome. Thank you for always coming on.
Yeah, always a pleasure.
Awesome. We do have David Zeckman coming on. He should be here momentarily. In the meantime, and I'm going to introduce you to the chat box with our video producer, Andrew, just said hi in. If you guys have any technical problems, anything with the audio or the visual, feel free to just message him at Andrew and he'll be sure to help you out there. If you look to your bottom left, there will be some poll questions that will be popping up there. So be sure to keep an eye out on those. We do have a couple of those throughout, as well as at the very end of the webinar, we do have a handout for you all. So it's just going to help you gauge through a couple survey questions. Will take a couple minutes. Just gauge how well you guys are prepared for your own mandate practices and organization, making sure your employees are all aligned. And for that, we'll actually be offering a $100 Amazon gift card for a lucky winner. So be sure to keep an eye out on your inboxes after the fact. And then to give a little bit of background on workforce.com, we are a software management company who specializes in scheduling and time and attendance. Our overarching goal here is to help business leaders and frontline managers make the best decisions for their companies. So we like to use these webinars as a way to engage with you all, to give you guys information based off what we've been hearing from our side of things, from operations, HR, and management personas, and kind of give you guys the best information possible. Bo, I'd love to hear a little bit about what you do, and hopefully David should be logging on with us any moment.
Awesome. Yeah. So my name is Bo Gersnich. I'm a business consultant here at workforce.com. I also help run our implementation team. So basically just dealing with a lot of different clients in a lot of different industries, from healthcare to staffing, hospitality, which can be anything from hotels to restaurants. So basically just trying to streamline processes for businesses that are utilizing hourly employees, and understanding what goes into that and helping consult to make that process better. So
awesome. That's great. Let me just get some information here. So Bo, to kind of start us off, with the Supreme Court ruling, what do you think about, everything that's kind of just been going on in the news lately? We've seen Supreme Court not only first rule that, they wanted everybody, or OSHA, that they wanted everybody to have the vaccine, all companies over 100, to now the Supreme Court ruling just healthcare, right? What are your thoughts on that? Do you think that this is something that you've seen a lot of backlash just from people that you've worked with personally?
Yeah, it's definitely a very interesting time. That decision, I think, it comes in after the fact of a lot of businesses have made adjustments for this. I know several companies who have laid off, hundreds or thousands of workers because they did not have, the vaccine mandate. And now that's no longer a thing for a lot of companies, with the exception of, the federal workers as well as the healthcare workers. And so I think that we're kind of in this interesting situation where we're now clarifying who should be mandated for these vaccines and why they should be mandated for it. In a lot of ways, I think it makes sense. The healthcare workers are more exposed, more prone, and, in these very high transmission environments. And so I think that the rollback of the decision makes sense. There's obviously repercussions for people who haven't made decisions on it yet, and there's repercussions for people who have already made those decisions.
Definitely. That being said, speaking to the audience a little bit more. We would love to have you guys drop in any questions in the chat. So feel free to, drop anything that you have in terms of thoughts, opinions. We're even willing to bring you guys on stage with us this time around. So feel free to even flag us with a raised hand, anything like that. We would love to hear from you all. Bo, in terms of qualification measures, what have you seen that some of these healthcare specific companies, those in the industry, have done so far to just kind of keep everything recorded, make sure that everything's aligned? Because these days it's so important to make sure that you're staying within compliance, right? And making sure that you're not going to get fined left and right, in terms of a lot of these precautions that everybody's taking after the ruling.
Yeah, definitely. I think the biggest advice and thing that I've learned in the industry so far regarding qualifications and how we're tracking vaccine status is we need to automate it. We need to get it digital in some way. So if you're like me, you probably have a paper vaccine card that you have in your wallet. That's great for me personally, but as a business, how are we tracking where people are at in their vaccine process? There's obviously, for most vaccines, the 2-stage process. And we want to have that reflected in our workforce in a way where management can see it from, a degree of frontline who are eligible to see that up to the top, so that we're maintaining an understanding of where our workforce is at. And so I think translating where the vaccines are at currently to where they need to be, it needs to be a digital process.
For sure. I think it's interesting. We've been hearing a lot from our team, our side of things. There's a big variety of opinions on what's going on with, the ruling. And a lot of people are not thrilled about it in the healthcare industry, especially those that are just over 100 staff. They feel it is unfair. They feel that, why 100? Why now, kind of thing. I think it's interesting to see just how, transparent a lot of people are being, and just in terms of their own statuses and their own traction of that.
Yeah, definitely.
Yeah. Awesome. Yeah. So just out of curiosity for everybody in the chat, you see a little poll question to your left. Are you guys aware of the current Supreme Court ruling? If yes, obviously click yes, and then no. We would love to just see where everybody's heads are at in terms of what the most recent, opinions are there. And feel free to drop any comments in the chat as well. Awesome. Cool. And then we should be getting David on very soon. In the meantime, so Bo, what are your thoughts on kind of from the compliance side of things? How have they changed kind of over the course of this pandemic in terms of people's utilization and kind of the emphasis on compliance and making sure that everyone stays in alignment?
Yeah. So from a compliance perspective, what we typically talk about are not necessarily eligibility to work certain jobs, but more about what happens when you work jobs. I think with the vaccine mandate, we've opened up to a larger degree eligibility for work than we had beforehand. Typically, we were dealing with, overtime rules, union rules, things that kind of come in and impact how people are getting paid. Now we're talking more about, are people eligible at all to work? And so for companies like a staffing firm who may be operating with one hospital or one client that does not require it or is not mandated it for, size reasons or, different industry reasons, but another that does, we can still retain those employees, but we have to now specify where they can work and where they can't work. So I think that's a unique new compliance, thing that's hitting the market.
Definitely. David, hi. Welcome. Hi. We missed you.
Oh, gosh, I apologize for being late. The techie things. Anyway, sorry, I apologize. So good morning, everybody. Thank you for your patience.
No worries. David, why don't you just, why don't you introduce yourself,
Sure.
kind of give a little background on what you do, your experience as an exec of a hospital and some healthcare facilities and all the coaching that you do.
Well, thank you. I appreciate it. Well, good morning, everybody. I hope everybody's avoiding the blizzard wherever you are. I live in Estero, Florida, so I'm looking out the window. And it's a little kind of sunny and nice. Sorry if I say that, Fort Myers.
Yeah, I wish I could relate.
I've been in healthcare 37 years. I started as an on-the-job trainee respiratory therapist. And prior to that, I was a teacher and a coach, and I loved it, but I was making $10,000 a year. So it wasn't conducive to family raising. And so I moved my way through the ranks and felt like, because of my teaching background, leadership was really my calling. And so I just moved up. I'm one of those few people that moved right from the starting entry job at the bedside to being a CEO. And I'm originally from Cleveland, Ohio, left there in 91, went to Toledo, then went to Kansas City, then went to Louisville, then back to rural Missouri. And I ended my career as a hospital CEO 2.5 years ago in Northern Michigan. I worked for McLaren Healthcare. And I had the Northern Michigan region way up there, which is getting tons of snow and cold right now. And right now, for this past 2.5 years, I'm still in healthcare, but I do some coaching of hospital CEOs. I wrote a book that will come out in the spring called Driven by Compassion, 8 Values for Successful Servant Leadership. I'm on a couple of boards. I'm the CEO of a startup company in the business of acquiring assisted living and home health agencies. So I'm staying busy, but in a very different way. So I've been obviously talking to hospital executives during this crazy time and wonder, well, if I was still the CEO, in fact, I have a call today. Somebody wants me to be their interim CEO. So I have to start thinking about what exactly would I do if I did that? And I've been thinking about that for a while. And I will tell you that this vaccine mandate and all the things associated with it is something that, pandemics are once every 100 years, at least that's at this one, but there's just nobody was ever prepared for this and clearly prepared for vaccine mandates and how they were going to affect the delivery of care and the staffing section. So I'll end my introduction that way. I hope that was helpful. And again, I'm honored to be here today. I'm honored that Meredith would ask me to participate with Bo, and we're ready to go.
Yeah, that's awesome. So, before you hopped on, Bo and I were kind of just covering the varying reactions and positions, opinions that people are having, specifically those in healthcare, to the Supreme Court decision. What would you say from your perspective as somebody who's been in the industry for so long and helped kind of coach a lot of different people, whether exec or even managerial positions? What does this mean for those in operations, CNOs, and other kind of managerial positions and their ability to retain staff?
Well, I think that's a great question, and it's a big one. The CNOs especially are the ones that are the CEOs. They're overseeing it, but you're talking about the CNOs and the nurse managers right at the front lines that are saying, well, I've got 20 patients today in my med-surg unit, and I need, let's say I need 5 nurses, and I only have 2. Now, you normally have call-offs and you have those kind of things, and that they manage to that, and they do a wonderful job, by the way. But the fact of the matter is, if where are you going to get those people? And usually there's in hospitals have a staffing pool sometimes that they use or a float pool. It's called float, and they float them from unit to unit to help support staffing shortages. Well, right now, I mean, if in point of fact, I just there's a healthcare system I'm very familiar with that last Friday just let go 240 nurses.
Wow.
Okay.
And how many were they at before? Do you know?
That's about. I should know. And she told me, and I'm sorry I can't remember. That's probably about I don't know, maybe 5%, maybe a little bit higher. But yeah, maybe about 8%. But still 240 nurses for 4 hospitals. Now, it wasn't all just nurses. It's everybody else, techs and things like that. But there was a shortage of nursing, as you know. There was a shortage of respiratory therapists. There's a shortage of radiology technicians, prior to the pandemic. Okay, prior. Now it's even worse. So, and I'm sure we'll get to later in the discussion today about, how are we going to address that and what are people trying to do? And nobody really has a clear answer. It depends on each individual organization, the culture of that organization, and the demand.
So that's really interesting to hear. So in terms of kind of going off of the demand aspect, so should management preemptively kind of start hiring sooner than later because of the mandate that's been laid down?
The answer is yes, they should be. And they're trying, and that they've never stopped hiring, as far as I know.
Right.
The pandemic caused that temporary slowdown, obviously. So the other thing that happened during the pandemic, I think, as you're aware, is that they because they had to stop elective surgeries, and they furloughed a lot of people. Now, that a furlough is a different classification of somebody being laid off. It's sort of a layoff, but sort of isn't. When you were furloughed, you were sent home and said, we don't need you now, but we want you back. If that makes sense. So a lot of the furloughed people never came back. What they found is that they decided, you know what, I don't need this anymore. I don't want to work. And so they're drawing benefits from the government, or they got to a point in their life where they were, older, and said this is just the impetus for them not to come back. And I think that surprised hospitals, because I think they thought that almost everybody would come back, and that just hasn't happened. Yeah. And so again, now you add that into the mix in terms of exacerbating, the shortage, and it makes it even more challenging as we go forward. So, just to add, to work in healthcare, it's hard work. I mean, it's really hard work. And I was, as you know, I just was a patient 2 weeks ago today. I had major back surgery.
Right.
First surgery in my life, and first time as an inpatient. Unfortunately, the former CEO knows way too much, and so we're not the best patients in the world. But
I know all the good deals on the menu.
Yeah, right.
Yeah, so that's great. But the thing is that I would ask them, and I talk to them, just each caregiver personally, and the one night, my last night there, I could hardly sleep, so I knew. No, but nobody, not one single person checked on me. Not a single person. Now, I know why, because they were short-staffed. They told me. So how could that, what if I had died? Nobody would have known, So, but I also see how hard they work. I mean, my gosh, they work hard, and it's hard work. And you're doing, especially seeing certified nurse assistants who really do. I mean, it's hard work. So, you have a lot of older nurses or certified nurse assistants that said, you know what, I've had enough. This COVID thing pushed people over the edge in terms of that too. So
yeah.
Bo, I'm curious, coming from more of the technological side of things, more of the automation side of things, what is your perspective here in kind of this really high turnover world and the healthcare industry, which doesn't necessarily align too well, right?
The thing that really was going in my mind when David was talking was, the furlough part and how people didn't come back. And I think that is a symptom of, the business not talking to their employees in a way where we made a decision and we didn't necessarily understand what the ramifications of that decision was going to be 6 months down the line. We kind of made an assumption that the employees were loving their jobs, that they were going to come back. And then when it came time, the bet that we made that they would come back, they didn't, right?
Yeah.
And so how do we prevent that in the future? Well, I think we need to get a better gauge and understanding of, where our employees are at in terms of that burnout or our, love of our job. Because you're right, David, they do work very hard. It's, an incredibly passion-driven or passion-oriented industry to be a part of, but that comes with a lot of hard work. And if people aren't seen the return, then why would they come back? How do we gauge that in the future? I think opening up that dialogue is what's important most of all. People want to be heard and listened to and be part of a bigger picture. And in a lot of ways, a furlough can, be the direct opposite of that. So let's engage them right now. Let's get them part of that conversation so they know, the real decisions we're facing as a company.
Yeah.
I don't know if you agree or disagree with that, David.
I absolutely agree, Bo. I need to hire you, my marketeer for my book, okay? Because, and I know this is going to be a shameless plug, but in my book, one of the values, you could sort of summarize almost a big part of my book is communication, okay? And you're absolutely 100% spot on. And that one of the things that I will say that we've not done as well in healthcare is really engage our employees in a positive way. And to your point about the communication, yes, I do think the communication did improve over the pandemic because it had to.
Yeah.
Now, if it had been better before the pandemic, maybe, to your good point, it may have got people to come back. It's about treating people with compassion, with kindness, consistency, and again, all those things I mentioned. But the communication is just critical, and we've certainly not probably done as good a job of that as we could have. So.
But to kind of follow up on that, and before we move on a little bit, how do you think that, HRM software like workforce.com would kind of help with that aspect of engagement?
Yeah, I think the opposite end of that is also who has the time to engage thousands of staff every day. The labor shortage is not limited to nurses or frontline staff. It's limited to HR professionals too.
Right.
And so how we manage how we are engaging our employees has to be thought of in terms of what is my capacity as an HR company, what can I automate, and how do I address issues as they persist or come up in a way where it's data driven and can be more systematic, as opposed to addressing issue here, and here for these 6 employees out of 10,000. I think that comes to collecting that data very quickly on a regular basis and addressing it with an individual and with people as it comes up, so that they know that impacts it and they continue to provide impact and provide feedback. Because it's one thing to collect feedback, but if you don't act on it, you don't acknowledge it, then people are going to stop giving it to you.
Right. That's the point. So. Exactly. Yeah.
Mm-hmm.
David, I'm curious, we kind of touched base a little bit on a lot of issues, right? But what is the number one issue that you're finding that a lot of these organizations are dealing with kind of in face of the mandate? And are we expecting much change in the coming year?
Well, I think there's a lot of there's a lot of uncertainty and concern about what is this? Hold on a minute. Something popped up my screen. There's a lot of uncertainty and concern about the future, and I think one of the biggest issue is, how am I going to provide the same level of services to the community that I serve? And that's the concern, I think, because there's another CEO that I work with at a hospital, and it's a rural hospital, but 150 beds, 200. And he said to me about a month ago, and you could tell you could tell the stress. Just talking to him on Zoom, and he said, I'm trying to figure out, what am I going to do if I lose, it looks like I could lose 40% of my nurses. I don't, and I know it sounds like we keep beating a dead horse. I don't think, and this is not a political statement at all, I don't think that the feds totally realize what's going to be the ramifications of this in terms of having enough people to deliver the care. And I think that's what the C-suite is worried about. To your point earlier, it just, Meredith, it's just to be proactive. Yes, hire people. They're trying. I mean,
yeah,
but they may not be there. So what next?
Easier said than done, right?
Easier said than done. And
Yeah.
there are some on the horizon. There are some technology solutions coming, and I can give you a little bit of flavor for that whenever you'd like in the conversation. But there are technology is going to have to help solve this. If this mandate continues, who knows? I mean, we just don't know. I mean, that's the other problem, is the uncertainty of, how do you plan when you don't know? And, hope is not a strategy. I love that saying, but you can't hope for something. You got to know what.
Yeah, that's good.
What do you think's going to happen? And
right.
So yes, I don't know if I've answered that or not, because I'm answering it the way I would as if I was a CEO and what my colleagues tell me. I mean, they're all struggling and to do this, and you don't hear about that on the news. Just barely recently, I think like last week, I heard a little bit on the news, the national news, about, well, how's this going to, this is going to have a negative effect on healthcare, and then they kind of went off of it. So I'm not sure why they're not looking into this more, but I guarantee you they will.
So it's interesting. We got a poll question, and a lot of people are filling it out. And many are saying, in response to what organizational pain are you or your organization currently facing in light of the mandate, a lot of people are saying hiring and or firing. What would you say, or what kind of actionable tips would you suggest to those that are struggling with this?
In terms of hiring and firing?
In terms of just in light of the mandate, it's got to be a really tough time for everybody, and probably a lot of personal decisions had to be made. What would you say in terms of, kind of from an HR perspective, I guess?
Well, it's never easy to fire somebody, and in this situation, you're not firing somebody for cause or for
Right.
bad performance, or you're laying them off. I mean, you are giving them, as hard as this is, you have to remember, they could still have a job. Okay. But they have a choice, and I'm not saying it's up to them, and whether they decide to be vaccinated or not vaccinated, they do have that choice. I just think as you talk to them, make sure that there's resources available, to educate them as best, to give them as much knowledge as possible about, this vaccine, and whether you take it or not take it, from a medical perspective. Provide resources. If they don't have a doctor, provide a doctor for them that can talk to them and make a decision between the two of them on whether they take the vaccine or not. The last thing, in my opinion, and this is just me speaking, the last thing you want is forcing somebody to take a vaccine that doesn't want to take the vaccine. And that, to me, that's not a good thing. But that's just my perspective on it. The people you hire, it'll be a little bit easier, because they're gonna know up front they have to have a vaccine to be hired, and
Right.
that's going to be the simple thing. But I think
the problem then is the pool of employees or potential prospects. How many of those are coming from previously being fired? You're basically just filtering out immediately. Everyone looking for work.
Yeah, I mean, I'll tell you, Bo, this is it's the craziest thing. We've never seen anything like this. I mean, so people have to be somewhat patient and hard. I know, easier said than done, especially when your livelihood is at stake. I mean, my gosh, I can't imagine having to make a decision, my livelihood or getting a vaccine. It's just so difficult. And again, I'm not saying you get it or not get it. I'm just saying that decision is just must be incredibly painful and difficult. So to your question, when we have those conversations, make sure they have all the resources they need to make the most informed decision they can make. And if they don't have a physician, have a physician, hire a physician, contract with somebody, to talk to each of these folks if they want to talk to a physician about, their own personal concerns related to the vaccine. And then that you've provided everything you can to give them most information they can so that they can make, the best decision they can. Because here's the reality, and this is another thing people don't understand. People don't understand that they could say, well, just tell the government, the heck with you. I'm not, we're going to do it. Well, here's the problem. Most hospitals' revenue, it goes anywhere on the low end, 50% to the high end of like 80%, their revenues from Medicare and Medicaid. Okay. If you're not a Medicare, Medicaid certified hospital, you're going to go under.
Yeah.
It's just that simple. And especially rural hospitals, the ones that are the only caregiver in a small rural community, almost all of their patients are Medicare, Medicaid. Mm-hmm. So that's and the feds know it. They know that's their leverage. They're going to control the purse strings to make it happen. And as much as we want to stop and scream and yell if we don't like it, the fact of the matter is you cannot afford to lose Medicare, Medicaid. You just can't.
No doubt about that.
Yeah.
We kind of touched on this earlier, Bo and I did, but compared to last year, compared to prior to the ruling itself a couple of weeks ago, right? What differences are we already seeing in the importance of compliance or the importance of qualifications? That a lot of HR, CNOs, just operation management are kind of putting on their organization.
Could you repeat that again, please?
Yeah, just what differences are we seeing in the importance of qualifications?
For people that we hire, or for those people?
Yeah, for those people that are pretty much managing the whole staff. So I guess HR managers, operations, CNO. So I guess what the question is, how much have the importance of qualifications and staying compliant changed since prior to the ruling to now? Are we seeing a lot more focus on it? Is there a lot more technological advancements? Anything of that sorts?
I don't know that, Amira, things have changed significantly in terms of compliance. I mean, these folks, there's a lot of things there's so many things in healthcare that we have to manage to compliance regardless of the pandemic. Okay. Right. So I don't know that that's changed significantly. I think that they got to keep doing what they're doing and doing it well. I mean, when I was a patient, this is interesting. I had 3 armbands on my left wrist they gave me. And every single time they wanted to give anything that they had to do for me, anything, give me a Tylenol or whatever, they would zap it with the scanner. And then they would ask me my name and my birth date. Now, I tell you that because that's a compliance thing, okay? And that's something that in terms of patient, there's a lot more patient safety things out there for them at the bedside than compliance things. Mm-hmm. But the compliance is documentation, and that's really their big thing. I think to take a step further, I mean, I guess what I would be looking for in a CNO today, or a nurse manager, or a respiratory therapy director, would be innovation, creativity. Okay, what's going to be your solution to staffing? How are you going to staff your night shift if you normally need 3 respiratory therapists but you only have 1? How are you going to do it? Okay, yeah. So that would be my biggest, because I, it's in the compliance and knowledge. You assume they probably have that. Of course, I'm looking for leadership skills. Leadership's a huge thing with me. So I hope that answers your question, I think.
Yeah, definitely. I think, you kind of touched a little bit on compliance really is just good documentation and good organization.
It is. And, well, and we've kind of gone overboard on the documentation thing. It's almost to the point where they spend more time sitting on the computer in your room than they do, really doing the real care. And I'm not, unfortunately, that is the world we live in. And that's just something that we have to continue to adapt.
Definitely. It seems like it's about finding more time in the day for, and this is much easier said than done, I'm sure, more time in the day to actually cater to the patients, opposed to sitting at the desk and, making sure that everything's checked off, you're staying compliant here, which of course is very important at the end of the day to avoid fines, all that good stuff. But, it still takes away from the patient care. And that's a huge component of a lot of healthcare facilities, of course.
Yes.
Yeah.
Yes. Well said. Agreed.
Yeah. Definitely. What's kind of going off that? What tools have you helped companies or organizations implement in the face of compliance? Any documentation strategies, anything where, it's really just based off that organizational concept, anything like that?
In terms of compliance, I think there's the number one thing, quite frankly, is an electronic medical record. Okay. And the electronic medical record is your documentation piece. I think the thing that, on a high level, I didn't get into the specifics of the day to day, but on a high, believe me, I was part of these conversions. Oh my gosh, it's a nightmare, and it's a money.
Really?
Oh, y'all have no idea how.
Oh my God.
But I think that the number one thing is to simplify that, especially for physicians. More of a point and click checkbox kind of thing is makes it simpler, so you can get through that faster, because that is it's a necessary need now. Everything has to be electronically documented. So that would be the number one thing that I would encourage healthcare leaders to do as everybody's evolving to an electronic medical record. I mean, I'm sure there are a few that are still paperless, or still a paper, but generally that's what it needs to be. Simple, it needs to be easy, it needs to be fast, and nothing angers physicians more than, nurses have to do it because we tell them, but physicians, I mean, I'm just being it, but physicians, they hate it. They absolutely hate it. And look, except for the young ones. The young ones that trained on it, they get it. They just go through it. But you're talking about middle-age, end of career type physicians. They hate it, and it says it slows them down. So that would be the number one thing I would say would be, in terms of ensuring compliance, is to make sure that those systems are current and up to date. The protocols are up to date. You make sure all the protocols are in. They're up to date. I'm getting, again, I keep going back to my own personal experience. I've seen it, but I'm getting a little bit of home care right now with a nurse, and she goes back into her, and a physical therapist, and they go back in and they look to see what the current protocol is for the surgeon who operated on me for post-op. Okay. So she's got it in front of her, and then that's how she treats, the incision and those type of things. And that really makes sense.
Right.
I will say this, she spends most of her time on that darn little laptop rather than with me, which is, she says it's ridiculous. She says but they have to do it. So the other thing you have to remember in compliance is that Medicare requires a ton of documentation. And so you have to be very alert to that and make sure, again, that's completed and it's done timely.
Mm-hmm. It's interesting. Bo, I don't know if you had anything to add on that. It looked like you were going to say something at a certain point, but.
Maybe I was just making faces.
No worries.
I think that, to David's point, it is all about getting things online, stop all the paperwork, nurses and all the, hospital staff. That's not really why they chose that profession. So limiting that is, going to be as
in everyone's best interest, right? Yeah.
Sure.
Well, to Bo's point, I mean, we all got into healthcare for one reason, and that's to help others. Help others heal. And Bo said it, and he said, that's the whole goal. And they get frustrated too when they can't do what they love to do, and that's almost all of them. I like taking care of patients, and so anyway,
definitely. We've been seeing a lot from our team, a lot of issues that have occurred for a lot of these healthcare organizations when a breakthrough case or kind of when a vaccinated person still gets COVID. How do you manage these cases when staff is vaccinated? It's still, we've seen it through Omicron, right? Almost everybody has had Omicron, whether vaccinated or not. So how do you manage that amongst staff?
In terms of somebody on the staff has a breakthrough case or gets COVID and they've already been vaccinated. I mean,
Right.
it's just like everything else. I mean, you have to follow your policies and protocols in terms of, you have to treat it like an initial infection again, and you have to go back and that person has to be isolated and quarantined and that type of thing. I haven't heard of anybody or seen or heard anybody closing down units because one of the staff members tested positive. They usually just try to send them home at that point. So I wouldn't close a unit down. It just doesn't happen that way. I can't do that. I can't afford it. If that is what we did, then we wouldn't have any units. So, we have to, got to stay open, and, you just got to, each organization has a policy and a protocol to follow, and that's what they have to follow. And again, a lot of that depends on state regulations. And as you know, every state's different too. And that's what makes it even more complex. Right. I can tell you, in the state of Arkansas yesterday, finally the governor opened up. My daughter lives in Hot Springs, Arkansas, and she's a doctor of physical therapy, and she has a 4-year-old and a 1-year-old, and they, the 4-year-old's class somebody's constantly getting COVID, and then they shut it down for 10 days, and they both work. I mean, it's an impossible situation. Right. So the governor finally yesterday opened it up and said, schools are going to stay open now no matter what, which was obviously a godsend for my daughter and my son-in-law. But so it just depends. Every state's different. Every hospital is somewhat different. And again, it's managing. One of the things one of the positives that comes out of this for management leadership is that it really kind of it I won't say tests, but it tests your leadership style and your leadership, and a lot of people are shining through. I mean, they're just doing amazing work in spite of all of this, and because they're great leaders. And now it emphasizes that and says, "Hey, I've got to do this, or I have to do that." So,
I think with a lot of these breakthrough cases, it really does turn the tables, because again, it's like it's almost like 2 steps forward, 1 step back, or even maybe vice versa, 1 step forward, 2 steps back, because then it leads to even more short of staff. And I think, Bo, I bet you can speak on this a little bit more too, but with technology, it's really great to be able to track exactly kind of when that leave period is, when they do have to take that isolation period. And, we're finding just on our side of things here at Workforce that a lot of operations, CNOs, that type of persona is having a lot of problems with breakthrough cases. And, again, kind of having to retreat back to that short staff, even with the vaccine very much rolled out in this point of time. Yeah.
It's a morale issue too. I mean, I hate to say it that way, but here somebody took the vaccine, maybe may have been opposed to it, but took it to keep their job, and then all of a sudden they get infected, and now they can't work.
Right.
Right.
I mean, how do you, again, none of us have been through this. So, it's just sort of, as I said earlier, it's going to create some amazing leaders. And once we get through all this, I see really good things ahead on that part.
Yeah. And I think that the best leaders are honestly just practicing humility with that. Because the fact that we all haven't been through this is what should be shining out. And, if you claim that you know the answer, then you probably don't. Right? So I think just being willing to listen, being humble, and we get through this together that's I think that's been the message since the start. And
no doubt,
I think along the way we may have lost track of that, but I think we should the closer we can get back to that original messaging, I think the better we'll be off.
I think, ending this on the note of we are all in this together is truly like a high point, considering the topic at hand and the unfortunate circumstances that we know a lot of our healthcare organizations that we're working with are struggling with right now. So we hope that, this webinar was really insightful for everybody. David and Bo, thank you guys so much for coming on, as we're coming up on the 45-minute mark.
Of course.
But I just wanted to thank you all for being here. We do have a little survey for you guys that will just pop up right on the bottom left of your screen. We are offering a $100 Amazon gift card to a lucky winner. So if you fill it out, be sure to keep an eye out on your inboxes. And we'll hopefully see you at the next webinar.
Meredith, is there any time? There's no time left, right?
There is no time left. Unfortunately, we're pretty
I
much out. I know it goes by so fast.
I've got a couple of suggestions of what people are doing, but maybe we could do another webinar on that.
Yeah, definitely. We'll have to share them through maybe a follow-up email. So we'll be sure to send that out to everybody.
Okay.
Awesome. Cool. Well, thank you guys
so much.
Thank you, everybody. Nice meeting you.
Have a good one.
Good luck. Blessings.